Well, as South Africa prepares to evacuate over 150 citizens from Wuhan in China, Senegal in West Africa has confirmed its first case.
Algeria has also confirmed 2 new cases, bringing it to 3 the number of cases in that country. Egypt and Nigeria have also reported 1 case each.
Authorities in Iran have confirmed 500 new cases, bringing the total to more than 1,000 with 66 deaths. This is the highest number of deaths outside China.
The total number of confirmed cases in Italy has risen to above 2,000 from 1,694 on Sunday. 52 people there have now died from the virus.
The coronavirus has infected over 80,000 people globally and has claimed over 3,000 lives.
Thousands of travellers from neighbouring countries passing through the Beit Bridge Border post in Limpopo are apparently not being screened for the coronavirus.
Last month, the Department of Health promised it will be thoroughly testing travellers at the border following the outbreak of the deadly virus in China. Thousands from neighbouring countries and beyond that pass through Beit Bridge daily. They say they are not being screened for COVID-19. This despite the Department of Health promising there would be enough diagnostic kits and officials to do so.
Numerous attempts to get a comment from the National Health Department were unsuccessful.
We are now joined by Dr Angelique Coetzee, the National Chairperson of the South African Medical Association in Pretoria. Dr Angelique, good evening and welcome to The Full View. Let's start off here looking at all the plans that government has announced so far, including the evacuation of some of the countrymen in China. Do you think that the plan that we have in place is watertight?
Good evening. The plan for bringing the people in from China is very well thought out. It is according to the WHO or the World Health Organization's prescriptive guidelines, and as long as everyone do what they are supposed to do, that should not be a problem.
Mm-hmm.
On the borders, what I have just seen now, that might be a problem. Mm. And if you want to screen people, you cannot only screen them on all our airports. You'll have to screen wherever you can. And that is for me a bigger problem, because you do not know what walks through your borders.
Mm-hmm. Does this mean that there should be now focus on these border posts?
Yeah, I think so. I would, or someone would highly recommend that they start screening on the border post, especially when the first cases are being acknowledged in South Africa. Then that would be absolutely compulsory.
And what is that screening process, Dr. Angelique? Because some people have said, and some experts have said as well, that when it comes to the screening, that you might do the screening now and find out that the person doesn't have the symptoms of high fever, for instance, but only at a later stage starts showing those symptoms.
It's absolutely true. That is one of the problems. That is why when you start to screen, you screen especially the people with the history of coming from a place that is currently infected by the virus, or that you have been in contact with someone who is carrying the virus or infected with the virus. And then you also look at the medical symptoms, which is a guideline, but you would look there at temperature, about 38, symptoms of a dry cough, body aches and pains, and a rigor, it's like very much like your flu-like symptoms, except you will not have a running nose and a wet cough.
Should this be...
But it is difficult.
Sure. Should the neighbouring countries themselves, if we speak, for instance, about if we speak about SADC, should SADC as well also have its own plans around dealing with the coronavirus and how it responds to the coronavirus, and also ensuring that the immigration officials at all these border posts are kept abreast about all these symptoms that you've just mentioned now as well?
Yes, that is very good precautionary preventative measurements that would be put in place. I would think that is already happening, and but it's difficult for some of the medical association to go out and check whether everything is happening. We are relying on our members and the public to tell us, and then one can always escalate that to the National Department of Health and ask them whether they are aware of this.
And what are your members telling you about the plans that have been put in place, including the training?
From the public sector, they are, the different facilities are having their own training based on the guidelines of the WHO, but it will depend on each facility how good they train and prepare their members or their workers there. From the private sector, at the hospital levels, I think there would also be some guidelines in place. Our concern, however, is the average GP out there and nurse working in solo practice or in group practices, but not being part of a hospital group or the public sector. I think there's still a lack of knowledge and what to do. And then also the public should also remember they play a huge role here. It's not going to be the government that's going to save you here.
Yeah.
It's how good we all work as a team and we all understand what is expected of us. And if we can get that message out there, I think we will be halfway through the problems.
Okay, Dr. Angelique, just in closing, do you think that as a country we are ready to deal with the coronavirus and also some of the concerns that you have as a medical doctor, noting some of the concerns that you've raised during this interview as well?
If there are cases, the severe cases, and it's not a lot of cases, then there would be space in the hospital in ICU. Remember, it's not all hospitals that would be able to take these patients, but if there's a huge influx of sick patients, we will be in trouble. In the private sector, at the GP level, I have got great concern because there is no masks available. You have to see your patients with protective gear. You'll need to make sure that you have a dedicated area if you want to see them. I don't think we really grasp the importance of this type of patient and preventative measurements that we need to be put in place. And I think also there's a lack from the patient side and the normal public, what will be expected from them, and we have to get that out.
Is it fair then to say, Dr. Angelique, that you are not as confident that the plans that the country has in place would be able to deal with the corona outbreak, should there be one?
If there's an outbreak and a lot of patients being infected, we will be in trouble, especially if you only look at your gear, just looking at the lack of masks. And that is not the fault of the government. It is worldwide out of stock, and it was not anticipated that this should happen. So I don't think we will be able to cope very well, especially with community contacts, giving the disease from one person to another person.
Okay, thank you so much, Dr. Angelique Coetzee, the National Chairperson of the South African Medical Association. And let's move on.